Hey you guys, this video, I said I was going to do this video, um, and it's a specific topic talking about PCOS, which is polycystic ovarian syndrome. This is a condition that affects your ovaries. It affects about maybe, the numbers just seem like they keep going up. It's about 14, maybe one of 14, one of 15 every woman. um, your body's producing too much insulin. It's causing an excessive amount of androgen and affects the ovaries and causes you not to ovulate. You could be high risk infertility, diabetes, heart disease, and possibly the worst I say is cervical cancer. Um, I've been dealing with this for about 5 years, and my purpose for actually going to a doctor and seeing what the heck was going on with me. One, I was getting just like excessive hair growth, like places that men are supposed to get hair. Um, my energy level um, decreased. Um, I was always tired sometimes. Just at midday, I would just crash, and I thought it was because maybe, oh, I ate lunch and I changed the way I was eating. I would just maybe have a salad or just like a fruit salad or just like a regular salad or something. Just eat really light, no heavy foods. And the same thing, my energy was just, and I decided to go to the doctor. At this time, I was 18. I was 18 years old, and I got blood work drawn. I went to the doctor and I was like, "Hey, these are symptoms I'm having. What's going on? It's not right." So we took blood. I got my results, and I found out I had a high level of testosterone, and it may be linked to PCOS. Um, the doctor then suggested I go see an endocrinologist. Excuse me, I'm probably jacking up the term. I don't know how to medically pronounce it correct. Um, so as time went by, maybe about 3 years went by, I wasn't getting, um, well, those are my only symptoms at the time. It was the the lethargic, the lethargicness, the excessive hair growth. Those are just like my main two. And then as like 2, 3 years went by, my periods just start like being MIA, missing in action. They would go for like 5 months at a time, just no period. And I just knew like this is something serious. This is not supposed to happen. What the heck is going on? So I ended up going back to a doctor and actually going and seeing a gynecologist, OBGYN. And I was like, kind of telling him, like, hey, this is my past. I had blood work drawn. I was told that I may have PCOS. These are my symptoms. And I kind of went on about my symptoms. And so we took blood work. He gave me a pamphlet to read about PCOS. And then scheduled for the next week for me to come back in and for me to get my results and do an ultrasound so we look at my ovaries and kind of see what's going on. So my blood work came back this time. Everything came back normal. My doctor said, well, guess now we're going to do the ultrasound because this will actually bridge the gap with the normal blood work, but these abnormal symptoms. So yes, indeed, it was like these little pea-sized circles like on my ovaries, which were the cysts. I had like 6 on one of them and then a few more on the other one. So he was like, yes, you have PCOS. So when we were done with the ultrasound, we sat down and we talked about my options. Well, the first thing he was telling me, which kind of made me feel good, was he said that just because you're high risk of infertility, heart disease, cervical cancer, or diabetes, it doesn't mean you're going to get them. You may get one or two, or may get none, or you may get all. But just because you're high risk does not mean you're going to get it. He said he has women that come in that have PCOS that don't have a problem getting pregnant. Um, he said his job is to monitor me my glucose, my blood, so we can make sure everything is normal and prevent me from getting any of those detrimental diseases. That made me feel really good because I was super worried. I want to have children someday, and I'm like, dude, I need these ovaries to be working. He gave me two options as far as treatment. I don't have I say I don't have a severe case of it. There are some women that deal with weight gain, acne. They're trying to get pregnant, they can't. Those three things I have not dealt with. And it's heartbreaking to hear other women's stories of how they're struggling with it. Some are struggling with depression. It's just so, and my heart just goes out to them. Like, yeah, I had this condition. I've been dealing with it for like 5 years, but I haven't had it to the extreme. Some women go bald. I may have a little, I call it a beard. I may have a little beard. You can't even see it. Someone said it's a peach fuzz. But that's nothing compared to what other women go through. And I just want to take a second to kind of just commend them for their courage and their strength. I admire it. Here I am with my little, I have facial issues. But there's some women that are just going to the limits. They can't, they're trying to get pregnant. They can't. They're trying to deal with the depression. They can't. They're trying to shut off weight. They can't. And I have not dealt with any of those within the 5 years of dealing with PCOS. But I just pretty much want to tell you about my story. My doctor gave me two options. I could do, like I said, because I'm not dealing with the weight gain. I'm not trying to get pregnant right now. So I just had two at this time, at this period. Which was, one was birth control to actually make sure I get my period every month, which will prevent the buildup of the cyst that may lead to cervical cancer. And it will actually minimize, if I said that word, it will actually decrease the pain I get from my menstrual cycles when I do get them. Or I could just, whenever, my periods just kind of skip, act like they don't want to come, I can, call my doctor and say, hey, it's not coming on. And he said they can prescribe me something that will actually jumpstart my period. So I actually went the birth control route to actually make sure I do get my period every month and avoid the buildup of the cysts and to decrease the pain that I get every month. So that's the route I personally chose. I just want to encourage you guys, anyone that think they think they're having these symptoms or maybe have PCOS, actually, just write down these symptoms. Actually search for doctors that actually may specialize in PCOS and get under a good OBGYN care that will monitor and actually teach you along the way. Because like I said, everyone is different. Like I said, I personally had two options because of where I am. Like, I'm only dealing with the facial hair and the skip periods. Like, I'm not trying to get pregnant right now. And I'm not having an issue with weight or acne. Like, everyone is different. Every patient is different. So definitely write down your symptoms. Discuss it with your physician. Let him run all the tests he needs to run, so he can explain to you, share with you the way it can be treated and your options. You can kind of pick what option works best for your lifestyle, for where you are and what you're trying to do, what you're trying to accomplish. But like I said, I just want to encourage you that, just because you have it doesn't mean to have you. Like I said, get under a good physician that's going to actually monitor your health. Like my doctor said, we're going to monitor my health to make sure we can try to prevent these things in the future. So if you have any questions, please message me, rate, subscribe. If you want to share your story, please do. I just want to encourage you guys, and like I said, I just want to take the time to just honor the women that are going through the same thing, that are struggling with more severe issues than I am. I just want to commend you for your courage and your strength, for being brave and fighting and getting through it. Other than that, I guess I talk to you guys later. Until then, next time.